This part of week 4 is going to focus on the Partners in Health model. The article that we're reading this week looked at delivering AIDS care equitably in the United States, and it looked at the differences of AIDS care regarding whether you were a Black individual or a white individual. So the basis of the article is looking that for any type of disease, there's a disease course. If you have effective diagnosis and you have the correct staging or diagnosis or testing and you're treated, typically your disease course will go well, or as well as can be. So what was found in the United States between the Black population and the white population was a disparity in HIV care based on some structural violence examples: poverty, gender inequality, and racism. So the study question that was put forward was, what would happen if social inequities no longer determined who had access to the standard of care? And so the article goes on to explain how the disparities were removed. Poverty, gender inequality, and racism were removed, and it was found that there was no difference in access to care and standard of care between the Black population and the white population. So this is a form of structural violence and how the structural violence was removed. The Partners in Health model decided to take this a little bit broader. And so the Partners in Health model has been really successful in delivering effective care, both for conditions in developing countries like diarrhea, pneumonia, and childbirth, but also for complex cases like HIV care and tuberculosis. And so the reason they were able to provide such successful care was that clinical and community barriers to care were removed. And it was a very much community-based model. It was highly successful, and the key was the training of community health workers. And so these community health workers were found to be the most effective way of removing structural barriers that prevented adequate treatment. And so I'm going to go on to explain the Partners in Health model. And so you have the accompanier here. That's a community health worker that maybe is living in a community where TB is very high. These individuals will be taught how to administer TB medications, maybe screen for TB, but they will go and they will visit each of their patients every day in their small community to ensure that they're taking their TB medications and assess how they're doing. So they will visit the house every day. Twice monthly, this community health worker may go into the health center to pick up medications or training, or they may call their leader, who has about 20 to 30 community health workers, for support. Twice, and then the patient, once a month, may go into the health center for a consult on their disease. So whether it's tuberculosis, maybe they'll go into the health center to get an x-ray and they'll be seen by a physician. And so what the Partners in Health model has done is they've removed the structural barriers to care. Is that the individual is at the center, they have proximal care in their small community by a community health worker, and then if needed, the conventional clinic-based services is still there. So the Partners in Health have developed a nursing program to try and build our nursing capacity. They develop best practice guidelines for global health care in resource-limited areas. They do service training, service delivery, and research. They are focused on strengthening nursing education and building specialty expertise, say as a midwife, as in child health and TB and HIV and chronic diseases. And they identify and support nursing leaders to improve training and enhance patient care. I'm just going to take you to the, so you can see the Partners in Health nursing platform here. You can go through and you can read about the Partners in Health approach. And over here, you can see that they're very active. They're constantly posting on work that they're doing in developing countries to build that nursing resource in developing countries. So in our next part of the lesson, we're going to look at a film called Bendy the Arc. It's based on Paul Farmer and his work in Haiti, and Ben Affleck and Matt Damon took this story and made it into a movie that looked at three young activists who saved millions of lives by rethinking the way healthcare is administered in the developing world. And they took the Partners in Health model and applied it to populations in Haiti and Rwanda. So stay tuned for that movie. It's an excellent movie, and it really will tie everything that we're learning about together with primary health care, structural violence, social determinants of health, and the Partners in Health model and the community health workers.